Good morning, everybody. Welcome to Tuesday. Absolutely delighted to be here and to see all of you here as well. This is a really important milestone to be deeply into this process now of co-creating the future of vaccines and immunization. And this is really about defining the aspiration and path to success for the next decade. So welcome to Geneva. For those of you who have come from afar, we hope that the time that you're spending traveling and in this facility working on this vision is time well spent. For those of you from Geneva, we're really appreciative for setting aside these 3 days to dedicate yourselves to this work. So over the next 3 days, we're going to co-create the key elements of the 2021-2030 vaccine and immunization vision and strategy. This is not cooked. This is not a meeting where we're coming to see what a draft strategy is and opine on it. This is the place where we're going to try to work our way together through to what that new vision and strategy is. And the reason we have to do that is GVAP is coming to an end in 2020, and we need this new vision and strategy in order to set a compelling, country-centric, country-driven direction for the next decade, addressing those emerging issues that we all have been talking about for quite some time and harnessing new solutions. It's also important that this reignites the importance of vaccines and immunization for the health agendas and for all of the flagship programs that are out there, and doing that through the partnerships. So I really want to emphasize that this is going to be a shared vision and strategy made with countries. Many of you in the room are either from countries or deeply work with a large number of countries. So it's with countries, for countries, to create impact and align the global and the regional stakeholders fully directed towards the actual impact in countries for those ministries of health, for those health workers who are the ones actually holding the drops or drawing up the syringes to deliver vaccines. And so we're really intentional in putting the populations, the people in countries at the center with those ministries of health, and then the regional organizations, the manufacturers, academia and research, the CSOs and NGOs, the global partnerships, and the donors are all supporting that process. But this is not about strictly about the partnerships. It's really about the countries. And when we sort of go up a bit, vaccines and immunizations are really at the center of the broader health and development agendas to really achieve the SDGs. Here's just that wheel of the SDGs, and of the 17 SDGs, I think we can clearly map vaccines and immunization to 14 of them. The 3 that it's a little more difficult to see the connection really have to do with the environment, oceans, and those kinds of things. And I think that would be a bit of a stretch for us to envision how vaccines are contributing to healthy oceans. So this is making our work in this forum absolutely essential, because you can't get to success on these SDGs except with a path through vaccines and immunizations that is successful and driving forward. So the vision and strategy is the first core component of the plan. This is the part that we're working on here, and the intention is that this will then eventually go through the WHA process with endorsement, we hope, at the 2020 WHA. So again, I really want to emphasize this is about a plan, a vision, a strategy that the countries are endorsing and intentionally expressing their commitment to. So this is what we're going to be working on in this forum. Once we understand what this vision and strategy looks like, in parallel, we will start considering what the implementation plans would look like. There is certainly a set of revised monitoring and evaluation guidelines that need to be developed, learning the lessons from GVAP about what these should look like, what they shouldn't look like. And then there needs to be an advocacy plan for the 2021 to 2030 period. So this forum is a key milestone in this journey to developing the vision and strategy. This is not the beginning. We've already spent collectively, plus many more people who are not able to be in this room, over the past 18 months, deep country feedback on both GVAP, what went well, what did not go well, and input into a variety of post-2020 plans that I'll show you more of. This forum is pulling on all of those things. We're trying to pull in and pull up all of that work that has been done over the past 18 months. What comes next after these 3 days, the work is not done. Between April and September is the time when we now will have a document that has to be the platform for which broad country engagement and engagement of the broader vaccine and immunization and development community can take place. So we will be, out of this forum will come a draft 0 document. Over the April to September period is the opportunity for people to react to it, to modify it, to massage that plan further, and to develop it into something that will, in fact, go through both SAGE, the executive board process, and on to WHA in May of 2020. Hoping that there is strong endorsement of that plan at that period, there is a period beyond WHA, which is again about now developing the operationalization, the monitoring and evaluation, and the advocacy. So I hope you can see where in this journey this particular meeting sits. It's neither the beginning and it's neither the end. It's a very important milestone along this pathway. This is really a meeting about doing this together. So there are over 50 organizations that are represented in this room. There are over 30 countries that are represented. And there has been foundational work that has gone into preparing for this meeting that's included over 110 people across 12 partner organizations. So the content that we're going to, the bricks that we're going to use to try and build this house, this story that we're developing, has already had a lot of hands on it and a lot of engagement. So we aim to achieve 4 key objectives in the forum. The first is to provoke new thinking and generate novel ideas. If we simply keep doing the things that we did during this current decade, we can be quite sure that we're going to end up with the same results. And what we're aspiring to is better results. So we absolutely want to be going from good to better. We're going to need some new ways of thinking. We're going to co-develop key components of this vision and strategy together. That's the second objective. The third is to initiate also novel ways of working together across existing and new sectors and new partners. Last night, we quite intentionally had the opening speakers be largely from outside the immunization community. For those of you who were there, you'll understand that. For those of you who weren't there, we had the Brazilian ambassador to the permanent mission here in Geneva talking about innovation in supply and middle-income country commitments. We had Kate Gill from the Human Rights Commission, and then we had a representative from the World Food Program who was talking about the innovation accelerator that they have in their program and how they're driving innovation in their program. So we're really interested in existing and new sectors in this partnership. And the fourth key objective is to co-develop this path forward with engagement and collaboration. So this is not a WHO plan. This is all of our plans, and that's the reason why we're here to co-create it. We're not coming with something that's already been cooked. So there are 3 key components for the vision and strategy. The first is the why. What is the value proposition? And I think for many for many of us, we can think of, well, that seems kind of obvious. I think we know what the value proposition is. We're going to challenge our thinking on that to broaden out our description for different constituencies of what the value proposition is in the vaccine and immunization space. The second component is the what. What are the strategic priorities that we have? What are the strategic interventions that we can imagine that are going to get us where we want to be for 2030? And the third component of this vision and strategy is the how. How are we going to do that? What are the operational enablers? What is the path forward? What's going to be different that's going to get us there and create this house as a reality? So setting the stage for the next 3 days, I just want to sort of bring us back to sort of where we're at now. The Decade of Vaccines has certainly achieved remarkable progress. 116 million infants received DTP3 in 2017. That is the most children ever vaccinated in a year. We should really ground our thoughts about the achievements that this decade has succeeded in. 4.6 million additional infants were vaccinated in 2017 compared with in 2010. 1.8 million fewer children were under-vaccinated in 2017. 3 additional countries achieved MNT, maternal neonatal tetanus elimination in 2017. 113 countries introduced new vaccines since 2010, and there's been a 140% increase in the number of NITAGs since 2020. So huge achievements in this decade. And we've learned from GVAP. GVAP was seen as a powerful tool to orient global immunization actors. It was the second global immunization plan following on the first, the GIVS strategy. However, it was difficult to implement, and implementation was hindered by a lack of clear ownership and accountability and an advocacy effort that started off really strong but lost momentum during the decade. So these are some of the high-level lessons that have been collected through the evaluation of GVAP, and ones that we want to keep at the center as we envision what this next decade will look like, so that we don't repeat limitations or errors from this past decade. However, in spite of the successes, most of the goals that were set 10 years ago will not be achieved by this decade. We still have 3 countries that are polio endemic. No region, not a single region, has measles elimination as we stand here today. Only 1 region is rubella-free. 14 countries have still not achieved MNTE, and MCV1 coverage is stagnated at 85%, substantially below, from a biological perspective, what we need to have in order to get to the measles elimination objectives. Fewer than 30% of countries have DTP coverage at the 90%, 80% district level, and yet 19 million children or more are still under-vaccinated. And although we've had huge success in introducing vaccines, there are still 25 low and middle-income countries that have not had a new vaccine introduction since 2010. So the work is not over. And I think we have concerns in the vaccine immunization community that some of our success may be part of our undoing, that parts of the development world see vaccines as so successful that the job is kind of done. And we all know that's not true. So looking ahead, we do anticipate major shifts that will impact the landscape that we're in. Political shifts, economic shifts, and financing shifts, demographics, new ways of working, technologies, and healthcare. Let me get a little bit specific about what some of those are. In order to address these, we really have to develop new delivery models for fragile and emergency contexts. We must cater to more multifaceted, hard-to-reach populations. We have to develop new partnerships and new ways of working with non-immunization partners that draws their objectives closer to our objectives. We have to build digital data and analytic capabilities in countries. We simply can't have clinics in 2030 working off the rudimentary systems that were developed for an immunization system from 30 years ago. This is our call to action on technology. We're in the 21st century. And healthcare, we have to articulate a more comprehensive vaccine and immunization value proposition. This is not just about mortality reduction. This is about poverty protection. This is about economic advancement of families. So we have to build out this value proposition that is much more holistic. Now, there are many recent strategies that respond to the changing context, and together they provide the building blocks for what we see this vision will be. There are global health strategies, the SDG Action Plan, the PHC vision for the 21st century, the UHC vision for 2030. These are just examples, and the draft global program of work. And my slides are stuck. Oh, there we go. Okay. Immunization roadmaps. We have the GVAP. There's a UNICEF plan that drives through 2030. There's a WHO IVB draft plan for the decade. There are regional action plans. So we have a number of immunization roadmaps. We also have disease-specific strategies on measles, MNTE, yellow fever, a new influenza strategy, meningitis, polio, of course. And there are partnership strategies. Gavi 4.0 leading up to Gavi 5.0, the Global Fund strategy, the GFF plan. What we're trying to do here, there are parts of immunizations in all of these. What we're trying to do is describe the overarching vision under which, the umbrella under which all or parts of these can sit. And we're going to build on common themes from recent strategies, certainly with equity within and across contexts, smooth transitions to domestic lead, fragile contexts and emergencies. Integration with health systems has got to be one of the central points of what we're going to envision for the future. And this important thing that I've mentioned several times is collaboration with new partners, using countries, communities at the center of the effort, with demand as one of the most critical components. And the innovation that we're talking about has got to be multifaceted. It's not about a widget. It's not about some new technology that's going to solve all of these problems. One of my core beliefs is that data is at the center of what we do. If we don't have disease surveillance and data to drive our decisions, it's almost impossible to know what we should be doing and how the programs can improve. I think we've seen from the GVAP that one of the weaknesses was governance and accountability. The plan was a good plan, but there was an insufficient architecture to actually hold individual stakeholders in that plan accountable for what they were achieving. And keeping the introduction platform ready, although we don't anticipate any big blockbuster vaccines in the next 5 years. When we look forward to the end of the decade, it is possible that there may be some very significant vaccines coming on tuberculosis, possibly HIV. We do have a new malaria vaccine just about to launch in its pilot implementation. And we seek to address open questions. How are we going to implement this? What are the implications for domestic funding? What is the link to other health and development agendas? What is the evolution of organizations' support models? What is that role of new technologies? What are the systematic and broader innovations that we're going to have? What are the requirements for data collection, analysis, and actual use at the country level, at the district level, at the clinic level? What are the metrics to improve reporting efficiency? So building on visions for global health, those roadmaps for immunization, what overarching shared vision for vaccines and immunization will we craft for the next decade? As I wrap up, I want you to keep 3 specific lenses in mind as we head into these days. First and foremost is country centricity. Anchor our conversations on what this actually means for a country, for their context, for their experience. focus on implementation and impact. The second is the contribution to broader agendas. Let's be really specific about what the articulated links are to the broader health, socioeconomic, and development agendas. And the third is innovation. Again, we have to do new things, working from what works already and building on that. Think outside the box. What will we do differently to create that impact in 2021 to 2030? So I hope this gives you some thoughts about how you're going to encounter the questions that will be asked in the workshop sessions and what we're trying to pull forward from all of you to create this draft zero. You've had some pre-reads, which I hope stimulated some of your thinking, and especially some of your quantitative thinking about where we are now and where we need to get to. So I'm going to wrap up here, and it's now my great honor and pleasure to introduce Dr. Anders Nordstrom, the Ambassador for Global Health for the UN Policy Department. And I welcome you warmly to the stage, Anders. We're excited that you're here. Thank you.